So osteochondral lesions are a pretty significant severe injury. Boy, are they hard to treat because a lot of them don't get better. So we're going to go through the best of the worst, I guess, treatments. OCD lesions, local injury of the articular surface and subchondral bone, can oftentimes lead to avascular necrosis. Obviously, if you get avascular necrosis of the talus, the only way you're really going to fix that is via subtalar fusion. Well, if you fix the subtalar joint and fuse that, you might get some blood flow into the talus to stop the AVN, but what you're going to do, obviously, is affect ankle joint motion. So now you're looking at an ankle joint replacement or what have you. So it just becomes one problem confounding upon another. So we'll just stick with Burt and Hardy. Stage 1, which you see in the picture on the right, top left here, is just a smushing of the cartilage. Stage 2 is a lifting of the cartilage with most of the cartilage intact. Stage 3 is the cartilage actually being broken away but laying in position. Stage 4 is the cartilage flipped upside down. So stage 4 is obviously the most difficult to treat. Stage 1, you have the best chance of conservative therapy working with cast immobilization, physical therapy, what have you. Nito lesions are more frequent. They are deeper but still have better healing potential, oftentimes less symptomatic as well. Can oftentimes result in avascular necrosis, and the reason being is because the medial side of the talus is just so darn thin in height. So the thickness is much greater laterally than medially. Surgical indications: absolute failure of conservative treatment, fragmented cartilage cap in stage 4 and 5 lesions. 5, again, is Rang's addition. It's a very large osteochondral defect by nature of the addition. Subchondral lesions, the goal is to protect and maintain intact cartilage, retrograde drilling. So even if the cartilage is intact, if it doesn't have a base or a foundation, it'll smush right down into the talus. So backfilling is a technique that we'll get into in a minute. You want to backfill beneath the cartilage, otherwise the cartilage is going to collapse down and you're going to have a real problem.